I'm Linda Elseygood, founder of the LDN Research Trust. It has been my honour to interview LDN researchers, prescribers, pharmacists and patients from around the world for many conditions. Thank you for joining us.
I'd like to introduce Dr. Paul Anderson from Washington, the United States. Thank you for joining me, Paul.
Thank you for having me.
Could you tell us when you first heard about LDN?
Well, my trip through knowing about LDN actually started about 20 years ago when I was doing my emergency medicine training, and we would, of course, use the cousin of Naltrexone called Naltrexone, and doing some study in the use of that. And then it kind of fell off of my radar because I was doing primary care medicine for the first 8 years in my practice. And when I started to develop more care of patients with autoimmunity and cancer, we started to see some of the early case reports that were coming out about LDN. And I believe that was probably about 10 years ago when we started to look into it and use it with our patient base.
Mm-hmm. And what conditions or cancers have you found good results with?
You know, what we have found, of course, with advanced chronic illness and cancer is that because each human is so individual in the way that the human body experiences the disease is so individual, we don't have any of the autoimmune or advanced inflammatory or cancers that we do not consider trying LDN with, because we've seen the entire spectrum of people, from people with multiple sclerosis, where it's made a very large difference in their treatment profile, to people with cancers such as some of the more difficult to treat, such as pancreatic cancer, and all the way to, say, lung cancer and ovarian cancer, where it's made quite a difference in their treatment profile. And so we still, to this day, and when I say we, I'm a medical director of a integrated clinic that has 10 physicians, so it's a fairly large group, and we consider LDN on the front end of treatment with both cancers and chronic illness for every type. And then what we do then is we see where it fits into their treatment protocol, and we see if the addition does indeed either add to quality of life or decrease in markers, or any medical marker that we can look at.
Mm-hmm. And what kind of results have you seen?
Well, much like other therapies, they're very individualized. We have we actually have a few cases where the only change that we made in a treatment program was the addition of LDN, and in both the autoimmune side, meaning things like multiple sclerosis and rheumatoid arthritis, that type of a disease, and then also in the cancer side, where the one addition of the LDN to the rest of the treatment protocol either decreased their inflammatory markers, decreased their pain, decreased other quality of life measures, or in a couple of cases, the one addition of LDN was the only thing the person could do, was able to drop the tumor markers down to normal levels, and the person is actually still alive. So it's highly variable as far as where it fits into the person's treatment program. But generally speaking, LDN is, we use many integrative and standard types therapies with both groups of patients. And LDN is one of the things that we have the least amount of any negative effect from. It's one of the medications I feel the best about telling the patient that they should try, because we just have almost no negative side effects from it, and very often it fits into treating the patient in a much better manner.
That's really handy to know, because we have people constantly, well, on a daily basis, asking for LDN prescribing doctors. So we'll have to make sure that we've got you on our list to refer people to you. Do you operate from just Washington?
Well, our clinic is based in the state of Washington, and part of what our medical center does is we participate in various human trials, research projects with patients that are centered around patients with cancer and or chronic autoimmune disease. So in some cases, we will have patients who come to see us to get started as part of a research project and then go back to their home state, and they're co-managed with the doctor in their home state. So we do have some patients who aren't in Washington, but the majority are from Washington.
Mm-hmm. Okay. And all patients, if they wanted to come and see you, do you do telephone consultations or just face-to-face?
We do have the ability to do phone or Skype consultations with patients, and the only caveat to any of those are that we have a partner physician in their home state or country, wherever they're at. And we do that quite a bit because of our involvement in research. We may be the only avenue for a patient to get a particular therapy, and then we can guide the home physician in the maintenance of the therapy. We do that with LDN quite a bit, actually, because a lot of physicians, as you know, aren't familiar with it.
Mm-hmm. Well, that's very interesting. Is there anything else you'd like to add?
I would say that in our two groups of patients, being cancer and chronic illness, in the cancer patient, there's so many variables that come up that it's a little harder to talk definitively about LDN and cancer, except to say that in 20 years of working with integrative oncology, I find LDN to be one of my most useful and safest things to add in. When it comes to the autoimmune side of our practice, such as patients with rheumatic problems, rheumatoid arthritis, even pediatric patients with rheumatoid disease, MS, etc., we find that LDN fits very well into their treatment protocols, and it's very rare that it does not improve either the outcome of the case or the quality of the person's life. We have actually had patients, pediatric rheumatoid arthritis patients, who we co-manage with the pediatric rheumatologist, and we have been able to, which is a very difficult disease, pediatric rheumatoid disease, very difficult, and we've been able to, by incorporating LDN into treatment programs with younger people, get them onto less or completely off of some of the other chemotherapy agents that they were on, and actually have them have stable improved disease, not stable disease. Mm-hmm. So we find it just incredibly useful and an incredibly safe therapy.
Wonderful. Thank you very much for sharing your experience with us.
Thank you.
Do you have LDN experience to share? If so, please email me, linda@ldnrt.org. I look forward to hearing from you.